Good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. Today, all of our speakers are joining the briefing virtually to adhere to social distancing guidelines. We will begin our briefing today with opening remarks from Mayor Kenney. Mayor, you have the floor.
Thank you, Kelly. Good afternoon, everyone. You will recall last week we announced that students and families would be required to present their student ID numbers in order to pick up meal boxes at any of the school district meal sites. Today, we are pleased to announce that this is no longer the case. Thanks to advocacy at the local and national level, the U.S. Department of Agriculture has extended the waiver to the National School Lunch Program. This means that beginning this Thursday, September 3rd, students and families can pick up a grab-and-go meal boxes at any one of the 62 school district meal distribution sites, regardless of what school they attend. Students or caregivers can pick up meals for the week each Thursday from 9 a.m. to noon. Meal site locations can be found online at phila.gov/food. Again, that's phila.gov/food. Again, also student ID numbers will not be required, and families can find, as I said, the meal sites online. We are excited and grateful to announce this change because our students deserve easy access to free and healthy meals as they continue their studies this fall. Today, September 1st, brings the start of Suicide Prevention Month. This month is of added importance this year as we all face the stress, anxiety, and hardships of COVID-19. In Philadelphia and nationally, we're seeing heightened levels of adverse mental health conditions. This includes substance use and suicidal ideation, especially among younger adults, racial, ethnic minorities, essential workers, and unpaid adult caregivers. Unfortunately, Philadelphia this year has seen nearly 17% increase in deaths by suicide in comparison to 2019. But there is hope because there is help. Philadelphia is one of the nation's best networks designed to listen, help, and care for all of us. If you are concerned about a loved one, you can follow these 5 steps. Ask directly if the person is thinking about suicide. Be there and listen without judgment. Keep them safe, connect them to professional help, and continue to follow up and check in on them. If you think you need help or are concerned about a loved one, visit mindfultogether.com, which is spelled MINDPHL together.com. There you will learn about the many free resources available to you, including immediate emergency help, self-assessment screenings, and much more. Now let me shift to another very important matter, the 2020 census. As you may have heard, the U.S. Census Bureau has announced that their self-response phase and field data collection will end on September 30th to comply with the statutory deadline of December 31st, 2020. If Philadelphia residents have not yet completed the census, they can expect the visit of a census taker who will help them to fill out the census. Census takers will wear masks and follow state and local health guidelines at all times. Philly Counts, the city's initiative to support the 2020 census, is focusing its efforts on encouraging census participation in Philadelphia's historically undercounted neighborhoods through phone banking and socially distanced activities. Since Philly Counts has started phone banking, the team has worked with community partners to make over 233,000 calls and engaged over 30,000 households. Philly Counts volunteers have assisted 13,800 households and making a plan to participate in the 2020 census. Despite the strong effort, only about 53% of Philadelphia households have completed the 2020 census to date, and we need to do much better. It is critically important for all Philadelphians to stand up and be counted. So I encourage residents, if you have not done so, fill out the census online at 2020census.gov over the phone or using this paper form. That's 2020census.gov. And now for Dr. Farley's updates.
Thank you very much, Mayor. We are seeing similar case counts for the coronavirus infection in Philadelphia, but we do have concern about an outbreak that's occurring at Temple University. I'm going to talk about that Temple outbreak, and I'm also going to talk about a new policy on sports competitions. First, though, some numbers. Since this time yesterday, we've identified 131 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 33,909 since the beginning of the epidemic. Now, for the past week that ended Saturday, August 29th, by the date in which the test was run, we averaged 97 cases per day. And that past week, we averaged 3.7% of the people tested being positive. That 3.7% is up slightly from the week before. But there's an important note here, and that is that our case counts include only Philadelphia residents. Many Temple students report their home addresses when they're getting tested, so they're not accounted for in our data yet. We're working to identify those Temple students in our data and to reclassify them as Philadelphia residents for our case count purposes. When we do that, those numbers will go up. In the past 2 days, though, I can tell you that 32% of the cases reported to us are in the age group of 20 to 29, which is the college age group. I think that large increase that large percentage does reflect the outbreak that's occurring at Temple. As far as deaths, we've identified 2 additional deaths since yesterday, bringing us to a total of 1,751 since the beginning of the epidemic. And remember, our data on deaths often comes in batches, so we'd expect to hear about more deaths later this week. On testing, last week, we did about 2,700 tests per day. We're still having a slow turnaround time for getting test results from one of the national laboratories, Quest, but the other laboratories are reporting generally within 24 to 48 hours. If people want to know where they can get tested, it's at www.phila.gov/testing. If you look at our website, you'll also see that our numbers on mask use are looking good. Last week, 90% of the people we observed leaving retail stores are wearing masks. That 90% level is a high enough level clearly to be protective, and we're pleased with that. We want that number to stay up there. Now let me talk about the Temple outbreak. There have been outbreaks that have occurred in many colleges around the United States in the past 2 to 3 weeks. Last week, case counts among Temple students rose rapidly each day. And as of the weekend, Temple University was reporting a total of 103 active cases. On Sunday, we sent a team up to one residential building off campus there that had 3 known cases in it. We tested 38 people, of which 15 or 39% tested positive. Then yesterday, the health department sent up another team to do testing on the campus. We tested approximately 410 persons. At the same time, Temple University tested approximately 60 persons. The results of those tests are not back yet. We expect to get those results either later today or tomorrow. Overall, these numbers are concerning, and the rate of rise is even more concerning. There clearly is an outbreak occurring among Temple University students. Now, our contact tracing is suggesting that the exposures are primarily in students who are living in apartments off campus, many of which have many students in one apartment. Many of our students have 4 or more students sharing one apartment. And they're occurring through small social gatherings. Now, the health department is working with the Temple Student Health Services and the Temple administration to try to contain this outbreak. Temple has suspended all but essential in-person classes for the next 2 weeks. And the health department has revised its college guidance to recommend against gatherings of any size, because we understood that some students felt that any gathering that had fewer than 25 persons was okay, and it clearly is not. So for any Temple student who is listening to this today, I want to be really clear that we're asking you to follow this guidance. You should assume that everyone around you is infected. Stay in your room or stay in your apartment unless you have to go out for essential errands. And wear a mask when you're around anyone else. Otherwise, this outbreak could grow quickly, and it could threaten the rest of the campus and the rest of the city. We will be discussing with the Temple University administration a longer-term plan as we address this outbreak. Now on to this issue of sports. As you know, a few weeks ago, the governor strongly recommended against sports competitions like high school football. Subsequently, the Pennsylvania Interscholastic Athletic Administration, PIAA, had its own policy that it put out recommending that this would be a local decision. So after internal review, Philadelphia had developed its own policy that will be posted soon, either later today or tomorrow. I wanted to summarize that policy now about sports competitions. The policy prohibits competitions in higher risk and contact sports, such as tackle football, soccer, rugby, and indoor basketball. It allows those teams to conduct practices, but with safety precautions, and they should be focusing on skill building, not on contact. The policy allows competitions in lower risk, non-contact sports, such as cross country, track and field, baseball, crew, and also allows games in parks for things like 3-on-3 basketball outdoors or flag football with no spectators and no tournaments. There are exceptions for this policy for professional or collegiate teams if their safety protocols are specifically approved by the health department. Now, there are safety precautions for all those activities that are allowed on the guidance that will be posted, as I said, on their website either later today or tomorrow. We're still on track for reopening restaurants and theaters on Tuesday, September 8th. And just remind people that's indoor dining at 25% capacity and with other restrictions. And theaters, it can open up with restrictions on the number of people and also without the ability to serve food, because if people are eating in a theater, that means that they're not wearing their masks. Indoor gatherings are still capped at 25 persons, and outdoor gatherings are still capped at 50 persons. Now, with the decline in cases that we've seen over the past few weeks, we get many requests to allow more activities to restart. And I do want to just remind people that although case counts have been falling, the virus itself hasn't changed. People haven't changed. The outbreak at Temple, the outbreaks in college towns around the country, and the surge in cases that are being seen in Europe right now shows us the virus has the potential to come back strong at any time. So we know it's difficult for people to maintain these safety precautions, but we need to continue to limit how we get together, and in order to avoid getting more cases and to avoid getting more deaths. So general guidance, avoid gatherings. When you get together with people indoors, that's when the virus is spread. Wear a mask when you're near others, including when you're near your relatives and your friends. And that advice is particularly important for people over the age of 65 or people with chronic medical conditions. All of our information is on our website at www.phila.gov/testing. Thanks.
Thank you, Dr. Farley. We will now turn it over to Armando, who will deliver the Spanish language translation of both the mayor and Dr. Farley's remarks.
Palabras del alcalde Jim Kenney para el martes 1 de septiembre de 2020. Buenas tardes. Como ustedes recordarán, la semana pasada anuncié que los estudiantes y las familias tendrían que presentar el número de identificación del estudiante para poder recoger las cajas de comida de los sitios de comida del distrito escolar. Hoy me complace anunciar que esto ya no es necesario. Gracias a la promoción a nivel local y regional, el Departamento de Agricultura de los Estados Unidos ha extendido la exención al Programa Nacional de Almuerzos Escolares. Esto significa que a partir de este jueves 3 de septiembre, los estudiantes y sus familias pueden recoger cajas de comida en cualquiera de los 62 sitios de distribución de comidas del distrito escolar, independientemente de la escuela a la que asisten sus hijos. Los padres, los estudiantes y sus representantes pueden recoger las comidas de la semana todos los días jueves a partir de las 9 de la mañana hasta el mediodía. Las ubicaciones de los sitios de comida se pueden encontrar en línea yendo a phila.gov/food. Les repito, no se pedirá número de identificación de los estudiantes y se puede encontrar los sitios de comida para estudiantes yendo en línea a phila.gov/food. Estamos agradecidos y nos emociona anunciar este cambio, porque nuestros estudiantes merecen un acceso fácil y gratuito a alimentos saludables al retomar sus estudios este otoño. Hoy, 1 de septiembre, también comienza el mes de la prevención del suicidio. Este mes es uno de los más importantes este año, ya que todos venimos enfrentando estrés y ansiedad por las dificultades inherentes del COVID-19. En Filadelfia y a nivel nacional, estamos viendo niveles elevados de reacciones adversas en la salud mental de las personas. Esto incluye el uso de sustancias controladas o ilícitas y constantes ideas en torno al suicidio, especialmente entre los adultos más jóvenes, las minorías raciales o étnicas, los trabajadores esenciales y los adultos que cuidan a los niños sin recibir ninguna remuneración por esta actividad. Desafortunadamente, en nuestra ciudad, en Filadelfia, hemos experimentado este año un aumento de casi el 17% de muertes por suicidio en comparación con el 2019. Pero hay esperanza, porque también hay ayuda. Filadelfia tiene una de las mejores redes del país, diseñada para escucharnos, ayudarnos y cuidarnos a todos. Si a usted le preocupa un ser querido, puede seguir estos 5 pasos. Pregúntele directamente si la persona está pensando en suicidarse. Quédese allí y escuche, sin juzgar, por favor. Mantenga a salvo a la persona y póngalos en contacto con ayuda profesional. Y por supuesto, continúe dándole su apoyo y haciendo seguimiento. Si usted cree necesitar ayuda o le preocupa a algún ser querido, visite mindfultogether.com. Allí encontrará muchos recursos gratuitos disponibles para usted, que incluye ayuda de emergencia inmediata, exámenes de autoevaluación y mucho más. Ahora, permítame pasar a otro tema muy importante, el censo del 2020. Como habrá escuchado, la Oficina del Censo de los Estados Unidos ha anunciado que la fase de respuesta automática y la recopilación de los datos de campo finalizarán el 30 de septiembre para así poder cumplir con el plazo legal del 31 de diciembre del 2020. Los residentes de Filadelfia que aún no hayan completado el censo pueden esperar la visita de un encuestador quien los ayudará a completar el censo. Los encuestadores utilizarán mascarillas y observarán las pautas de salud estatales y locales en todo momento. Philly Counts, la iniciativa de la ciudad para apoyar el censo del 2020, está enfocando sus esfuerzos en alentar la participación en los vecindarios históricamente subestimados de Filadelfia a través de la banca telefónica y de actividades donde el distanciamiento social aún sea posible. Desde que Philly Counts comenzó a conectarse con los residentes a través de la banca telefónica, el equipo ha trabajado con socios en la comunidad para realizar más de 233,000 llamadas y ha contactado a más de 30,000 hogares. Los voluntarios de Philly Counts han ayudado a 13,800 hogares a hacer un plan para participar en el censo del 2020. A pesar de este gran esfuerzo, solamente el 53% de los hogares en Filadelfia han completado el censo del 2020 hasta la fecha. Necesitamos hacerlo mucho mejor. Es de vital importancia para todos los habitantes de Filadelfia ponerse de pie y ser contados. Así que animo a los residentes a que, si no lo han hecho aún, llenen el censo en línea yendo a census2020.gov por teléfono o utilizando el formulario de papel. Y esta es la actualización en materia de salud para el 1 de septiembre del 2020. Tenemos un conteo de casos similar al de la semana anterior, pero estamos muy preocupados por un brote que ha surgido en la Universidad de Temple. Hoy discutiremos esta situación y las políticas que tenemos para los deportes en competencia. El día de hoy reportamos 131 nuevos casos con un total de 33,909 casos reportados en total. La semana pasada, que finalizó el 29 de agosto, el promedio de casos fue de 97 casos diarios. Un promedio del 3,7% del total de pruebas recibidas resultaron positivas la semana pasada. Esto representa un aumento ligero con respecto a la semana anterior. Es importante destacar que el conteo de casos solo incluye a los residentes de la ciudad de Filadelfia. Muchos estudiantes de Temple reportaron sus direcciones anteriores cuando se realizaron la prueba, por lo que no han sido incluidos en los datos todavía. Y estamos trabajando para identificar estos casos y así reclasificarlos, porque los números van a subir. En los últimos 2 días, el 32% de los casos fueron entre jóvenes de entre 20 a 29 años de edad. El 42% de los resultados recibidos pertenecen a menores de 40 años de edad, mientras que en las semanas anteriores se mantenían repetidamente por encima del 50%. El día de hoy reportamos 2 muertes por la COVID-19. En total, 1,751 personas han fallecido en Filadelfia a raíz de este virus. Y estamos recibiendo esta información por grupos, de manera que esperamos anunciar tristemente más fallecimientos para esta semana. Respecto a las pruebas, la semana pasada realizamos un promedio de 2,700 pruebas diarias. Aún uno de los laboratorios grandes tiene un severo retraso para entregar los resultados. Los centros de prueba pueden ubicarse en fila.gov/testing. Los números respecto al uso de máscaras en Filadelfia lucen muy bien. Vimos la semana pasada un 90% de cumplimiento en las tiendas. Ahora bien, sobre el bote del COVID-19 en la Universidad de Temple, esto es lo que podemos informarles. Han habido brotes en muchas universidades en los Estados Unidos. El recuento de los casos entre los estudiantes de Temple aumentó rápidamente, reportando un total de 103 casos activos para el fin de semana. El domingo se realizaron pruebas en un edificio residencial con 3 casos conocidos. 15 de 38 personas resultaron positivas. Ayer, el Departamento de Salud realizó pruebas a 410 personas y la Universidad de Temple a aproximadamente 60 individuos. Estos resultados estarán disponibles más tarde el día de hoy o el día de mañana. Los números son preocupantes y la tasa de aumento lo es aún más. El seguimiento de contactos nos sugiere que las exposiciones ocurrieron principalmente en estudiantes que viven en departamentos fuera del campus y en aquellos en los que más de 4 estudiantes comparten un departamento. También en pequeñas reuniones sociales. El Departamento de Salud está trabajando con los administradores y los servicios de salud de los estudiantes de Temple para contener este brote. Temple suspendió todas las clases presenciales excepto las esenciales durante 2 semanas. La guía universitaria revisada recomienda no realizar reuniones de ningún tamaño. Cualquier estudiante de Temple que esté escuchando, por favor, siga estas recomendaciones. Suponga que todos los que le rodean están infectados ya. Debe permanecer en su habitación o en el apartamento, excepto para realizar actividades esenciales. Utilice una mascarilla alrededor de cualquier otra persona. De lo contrario, este brote podría crecer rápidamente. Discutiremos con las autoridades de Temple nuestro plan a largo plazo. El gobierno regional no recomienda las competencias deportivas escolares como el fútbol. La política delineada por la Asociación Atlética Interescolar de Pensilvania señala de que esta es una decisión local. Pero después de una revisión interna, la política de Filadelfia se pronunciará pronto. Esta política prohíbe las competiciones en deportes de contacto y aquellos de alto riesgo, tales como el fútbol americano, el fútbol soccer, el rugby y el baloncesto en interiores. Les permite a esos equipos realizar prácticas con precauciones de seguridad orientadas al desarrollo de sus habilidades y no al contacto físico. Esta política también permite competencias en deportes sin contacto de bajo riesgo, tales como las carreras de pista y campo, el béisbol y otros. Y permite los juegos como el baloncesto de 3 contra 3 al aire libre o el fútbol en los parques, sin espectadores y sin torneos. Habrá excepciones para los equipos profesionales o colegiados que cumplan con los protocolos de seguridad específicamente aprobados por el Departamento de Salud. Las precauciones de seguridad para las actividades permitidas se encuentran en la orientación publicada en nuestro sitio web. Por otro lado, la reapertura de restaurantes y teatros aún sigue en pie para el martes 8 de septiembre. El servicio en interiores estará limitado al 25% de la capacidad y habrá otras restricciones. Los teatros podrán abrir nuevamente, pero sin ofrecer comidas o bebidas. Las reuniones en interiores todavía están limitadas a 25 personas y las reuniones al aire libre hasta 50 personas. Hemos recibido muchas solicitudes para permitir que se reinicien más actividades. Aunque el recuento de los casos ha ido disminuyendo, el virus en sí no ha cambiado y tampoco han cambiado las personas. Los brotes en Temple, en ciudades universitarias, el aumento de los casos en Europa nos muestra que el virus aún tiene potencial para volver con fuerza. Sepa usted que es difícil mantener las precauciones de seguridad. Por lo tanto, debemos seguir limitando la forma en la que nos reunimos para evitar más casos y más muertes. Por favor, evite las reuniones. Utilice una mascarilla cuando esté cerca de otras personas, incluidos los familiares y amigos. Esto es importante especialmente para las personas mayores de 65 años de edad o aquellos que cuenten con condiciones médicas crónicas. Juntos podemos ganarle al COVID-19, así que por favor, use una máscara. Gracias.
Thank you, Armando. We will now move to our Q&A portion for members of the media. And in addition to our speakers today, we are joined by Dr. Jill Bowen, Deputy Commissioner with the Department of Behavioral Health and Intellectual Disability Services, who can answer any questions about Suicide Prevention Month. In addition, Eva Gladstein, Deputy Managing Director for Health and Human Services, is also joining us today to answer any questions about the newly launched Eviction Diversion Program or the Parkway and Ridge Avenue encampments. We will start with questions on topics related to the COVID-19 pandemic. So if your hand is raised now for another topic, please lower it and we will get to it in the second round. Please remember, we do have limited time during these briefings, so only one representative from each media outlet is permitted to ask questions, and reporters are asked to limit their questions to 3 or fewer. For those logged in today, please use the raise your hand feature. It can be found under the participants list. We also ask that you use video to ask your question if you are able to. We will now unmute the reporters one by one to ask your questions, starting with Yaima Crespo of Telemundo.
Buenas tardes. Mi pregunta es sobre el programa de ejecuciones. Me gustaría saber para los televidentes este programa si tiene algún costo y cuáles serían los requisitos para poder solicitarlo.
Y las ejecuciones, Yaima, ¿te refieres a ejecuciones de desalojo de alquileres?
Sí, el Eviction Diversion Program.
Muy bien, gracias. Y esa pregunta es para el alcalde.
Creo que hay alguien, un experto sobre ese tema. Creo que anunciaron y hay alguien, no sé el nombre, pero es sobre el programa de Eviction Diversion Program. ¿Cuáles son los requisitos y si hay algún costo para esto?
This is probably best directed to Eva Gladstein or the mayor. This is in regards to the eviction diversion program. And Yaima wants to know if there's a cost and what are the requirements for people to sign up for this program.
So thank you for the question. There is no cost attached to the program. It can be accessed by a new website that we just set up, which is called PHL, evictiondiversion.org. It is available to tenants and landlords who would like to try to resolve their issues, without a court or eviction proceeding. The landlord is required to file certain papers, and it is available if a tenant has lost income due to COVID between March 1st and going forward through December 31st. But there's much more information on the website. Again, evictiondiversion.org.
Gracias por hacer esta pregunta. No hay un costo para el programa. Nosotros tenemos un sitio web nuevo que es evictiondiversion.org, donde la gente puede encontrar recursos, esto tanto para los inquilinos como para los arrendadores, y obviamente es para que les ayude a resolver los temas que puedan tener sin tener que pagar nada para ello, y para no involucrar ni a los tribunales ni para tener problemas, porque esto requiere a los arrendadores a presentar ciertos documentos, pero protege a los inquilinos que han perdido ingresos desde el 1 de marzo al 31 de diciembre de este año. Y por supuesto, esta información se encuentra disponible en el sitio web, que es evictiondiversion.org.
Y la siguiente pregunta es sobre el encampment. ¿Qué asistencia se le está brindando a las personas? Si hay algún tipo de asistencia de salud y también de alojamiento que se les esté brindando.
The next question has to deal with the encampment. We would like to know what assistance is being offered to the people there in terms of healthcare resources and housing.
We have been, for the last 3 or 4 weeks, hosting a Homeless Connect, where we have staff from the Office of Homeless Services and Behavioral Health and other providers available. We have offered services including recovery housing, residential treatment, shelter, as well as space in our COVID prevention sites for individuals who are over 65 or who have underlying medical conditions and would be particularly vulnerable. Some individuals have connected to various treatment programs, and we are continuing to be out there offering those services.
Sí, nosotros hemos ofrecido ayuda las últimas 3 o 4 semanas. Hemos hecho un programa que se llama Homeless Connect para poder contactar a los proveedores de servicios, las personas que los necesitan, incluyendo servicios de salud mental y servicios de alojamiento en lo que se puede. También les hemos dado alojamiento para que puedan hacer su recuperación para aquellos que sufren de adicciones y también para que tengan un programa de tratamiento residencial y otro de prevención de aquellos que están expuestos a contraer el COVID-19, especialmente aquellos que tienen más de 65 años de edad o tienen condiciones médicas preexistentes. Y obviamente tenemos estos programas de tratamiento disponibles para ellos y vamos a seguir presentes tratando de ayudarles.
Ya, muchas gracias.
Thank you very much.
Thank you, Yaima. We will now go to Laura McChrystal with the Inquirer. Laura, you just have to unmute there.
Sorry, I didn't realize I was still muted. My first question is about the outbreak at Temple. Dr. Farley, to what extent are you concerned, that the outbreak at Temple could spread into the rest of the population in Philadelphia rather than being isolated among the student population there?
Well, I'd say there's a substantial risk of that because many of these students are living off campus, or they're living in neighborhoods.
Okay. And you mentioned that there had been some contact tracing of the students, but then you also said they weren't being counted among, because they're not reporting their home address as Philadelphia. So who is the city's contact tracing team still working to get in touch with them, or how is that working?
Temple has received positive results on students that they have tested. And even if those students don't have a Philadelphia address, we have asked for those names and gotten those names and have called them up for contact tracing.
Okay. And my last question is about the restaurants and theaters reopening next week. What kind of enforcement will be in place to ensure that safety guidelines are being followed?
Well, a couple things. First, we have our ordinary restaurant inspectors that do inspections on a proactive basis of all restaurants in the city, and they will continue to do that. Then anybody who has a complaint about a restaurant, whether it's a food-related complaint or whether it's a complaint that they're not following social distancing standards, they can call 311, and then that'll trigger an inspection. And then in addition to that, we will be having additional staff that are not ordinary restaurant inspectors going out to restaurants to simply educate them about what their requirements are, about what their responsibilities are, providing information about that.
Okay, thank you.
Thanks, Laura. We're going to go now to Jack Tomsick with Metro.
Hello. Yes, this first question is for Dr. Farley. Does this outbreak at Temple show that it's maybe not possible to safely reopen colleges?
Well, we do know there have been problems with colleges around the country. We also know there are colleges that have not had problems around the country. We are in touch with the other colleges that have in-person classes in the city, and we're asking them again to look over their safety procedures. We're hopeful that some other colleges may be able to maintain it safely, but we're going to be very closely in touch with this and see if that's possible.
And then my other questions are for Eva Gladstein. Does the city have any information on how many people could be evicted when the evictions are allowed to resume next week?
We really don't know. In the past few years, there have been between about 14,000 and 20,000 evictions per year, and we would expect an uptick. I will say the courts are trying to work hard with us to kind of manage this, and in addition to the eviction diversion program, we're also still operating a rental assistance program that can be accessed until September 30th. So we're working on that locally. We are hopeful that in Harrisburg, they may be able to take some action to actually extend the eviction moratorium and to make the rental assistance program a little bit more flexible as well.
And with the eviction diversion program, is that something where both sides have to opt in, or how does that work?
The landlord will be required before filing an eviction action. So this only relates to new eviction actions that are filed as of September 1st. The landlord will be required to give the tenant certain notices, and those are all available on the portal that I mentioned before, and participate so long as we, the city, are able to provide a mediation conference within 30 days.
All right, thank you.
You're welcome.
Thank you, Jack. We're going to go now to Natasha Brown of CBS 3.
Hi, this question is for Dr. Farley, just in reference to the new sports policy that you discussed today. Does it apply to colleges and grade schools, or just colleges, or who will it apply to?
Well, the policy covers the whole area. The prohibition on contact sports competitions, that would be at any level, except it does not apply to professional or collegiate teams that have safety plans that have been specifically approved by the health department. So unless they have that, then it applies to colleges as well, but it certainly applies to grade schools.
Okay, thank you very much.
Thank you, Natasha. We're going to go now to Jeff Cole of Fox 29.
Hi there, folks. These are actually questions that COVID related to the murder rate for Mayor Kenney. If I could, I'll do them quickly.
Sure.
Mayor, over the weekend, the city topped 300 murders. And just today, the police department released a killing up here in East Mount Airy that looks like nothing short of an absolute assassination. Mayor, have you been able to get, and the police department been able to get your hands in any way around the rising murder rate? Why is this happening, and what your response will be to it?
It's happening primarily because the flow of guns in this city and other major cities around the country are unabated by the federal government. That could be helping us to interdict the guns that are flowing into our city. For example, Philadelphia police took 488 guns off the street just in the month of August, but they seemingly get replaced as quickly as we gather them. We've been working to implement our GVI, our group violence initiative, but we've been hampered, as you know, by the COVID crisis, because getting together with people closely is difficult. We are continuing to work to put our foot in places where we can intercept these happenings. But if one person is insistent on killing another person, they're going to find a time to do it. And it's likely that a police officer will not be around. Sometimes we are around the corner or across the street. We're doing our best as other cities are struggling with this increase in violence and increase in homicide, and we'll continue to do our best.
In an interview with our morning folks last week, the district attorney cited a statistic. The clearance rate for shootings in July and August were well under 20% in the city of Philadelphia. He said for August, the clearance rate or the solve rate for shootings was just 9%. Why is that, Mayor? I am not familiar with those.
I am not familiar with those numbers or the source of Mr. Krasner's insistence. However, it does take a little while sometimes to solve crime. So perhaps if the crime happened in 1 month, it won't be solved in that same month. So the numbers may look skewed. I think we are in the low to mid 50s, which is unacceptable also, but it's higher overall. And I'd have to get back to you with his source of those numbers and some other issues that relative to the interaction between law enforcement, the DA's office, and the courts have also exacerbated this problem with more people being able to make bail than normal.
The last question I have for you, Mayor, the flow of guns to Philadelphia, gun laws haven't been loosened in Pennsylvania. And while certainly folks argue that the gun laws are too loose, they haven't changed in any way. But there is a 30% jump.
The state has the state has kept us from enforcing gun laws more strictly for Philadelphia than any other part of the state. In other parts of the state, guns are part of the culture. They're used primarily for hunting. In Philadelphia and Chicago and New York and others, handguns are used generally to kill people. And as you saw when the pandemic first hit, people were lined up around the corner to buy handguns. And the handgun shops were considered essential businesses. Those kinds of things should not happen in a pandemic. We should be able to control the flow and sale of those guns during a crisis time so people have less guns in their hand, especially if they're on the street with them or if they're in their home with them contemplating suicide. It's better to keep guns out of their hands. We can't do that without our own specific laws for Philadelphia.
So do you think that the increase in purchase of guns when the pandemic started, do you think the increase in the purchase of guns?
That's two separate issues. Two separate issues. What I'm saying is that Philadelphia is not permitted to enforce gun laws more strictly than the state will allow. What we need is the federal government and ATF to continue to work with us to interdict the flow of illegal guns into cities across the country. With that kind of help, we can tamp down the number of guns. As I said, we took 488 off the street last month, and I'll bet you they're all been replaced by now.
Thank you, Mayor.
Thank you, Jeff. We're going to go now to Martin Pratt of Philly Your Black News.
Thank you. I have three questions. For Dr. Farley, the University of Arizona announced last week they were able to actually stop a corona outbreak on campus by using something called wastewater epidemiology. Do you think we would suggest that for Temple to look, or all of our colleges, universities in this area, whether it's Temple, Drexel, or University of Penn, to really start looking at wastewater as a way to prevent the outbreaks and to find people who are asymptomatic?
Is this just where they actually test wastewater to see for presence of the virus? We are working on doing that here in Philadelphia. It's still a technique I would consider sort of experimental, and we're in the research and development phase. where the idea is you test sewage water for presence of the virus, and that gives you a sense for whether people who live in the area that is served by that sewage system have COVID and whether it's going up or going down. It's still brand new technology. I don't know. We're going to have difficulty figuring out how to interpret the results. And that by itself isn't going to control the epidemic. It simply would say at best where it is and where it's rising. And we have information on that based on testing. So yes, we are trying to do that, but that's not going to help us, I don't think, contain this outbreak at Temple.
Okay, thank you. My next two questions are for the Philadelphia eviction, around eviction diversion. The website says that landlords are required to do this. Will there be any outreach or, I guess, marketing or communication citywide to tell landlords that they're going to be required to do this? Because tenants may see this or see the article and say to the landlord, you have to do this, and the landlord has no idea they have to do that.
Thank you for the question. Yes, there will be marketing. Again, it was just opened up last night. That hasn't rolled out yet, but several of the landlord organizations have been participating in the planning for the diversion program, have agreed to reach out to their members, and will do more general marketing through nonprofit organizations, community groups, registered community organizations, et cetera, to make sure there's full awareness. And everybody who's on this call is asking about that. I'm sure we'll be helping. So thank you.
To follow up to that, you mentioned something about 30, that this would happen if the city could provide mediation within 30 days. If the city can't provide, gets over it and inundated, what happens then?
Then the landlord would be able to go ahead with filing the complaint in eviction court.
And the tenant would have no recourse.
The tenant would be able to make a defense in eviction court, but then be in the judicial process. And the goal of this program, as stated, is diversion, trying to help both the landlord and tenant resolve any financial problems or other misunderstandings without the cost of going to court.
Thank you very much.
Sure.
Thanks, Martin. We're going to go now to Claudia Lauer of the AP.
Hey, how are you? I have a couple of questions revolving around the evictions, and I also have one about suicide prevention, but I can come back to that one in the next round. In terms of the evictions, I know someone asked if there were numbers at this point of how many were coming, but do you know how many have been deferred in the court system that will pick up starting today?
I don't have those numbers off the top of my head. We can get those to you. Obviously, there's been a moratorium for a number of months, but there were cases that had been filed and gone through the court process before the court shut down and before the moratorium. And the court could start executing on those evictions. And they could also, as of next week, start scheduling for cases that had been filed beforehand. As I said, the court has been trying to be cooperative, and they are scheduling cases in a manner to help ensure that everybody is safe if there is a court hearing. So they are much more spread out than they used to be.
Okay. And then with it looks like Labor Day being the day that, actual lockouts could start again. Is there kind of an emergency system for folks who, maybe they have kids, who are trying to go to school online and they're locked out of their apartments for an eviction clause? What kind of emergency system has been set up for those folks?
Well, those systems have existed in the past and will continue to exist. And those, if there's a lockout occurring and there's not been a court hearing or a writ served, actually the tenant can call 911. And in other cases, we have a tenant hotline, and I'll look up the number and we'll put it in the chat for you. Okay. And as well as the Office of Homeless Services will be available. I will also want to say that there's a possibility the court has seen that some of those cases are trying to settle on their own or mediate their disputes at this point in time. So we're hopeful there might be some process with the support from the courts. So some of those prior cases could also be settled, not through the diversion program, but more informally.
Got it. Okay. And I'll hold my other questions for second round.
Okay, thanks, Claudia. We're going back to Laura McChrystal of the Inquirer.
I just had a couple questions about the managing director's office. I understand that as of the end of the week is when Brian Abernathy is officially stepping down. Any update you can give on the transition to Tamar Alexander as the acting managing director and a search for a permanent replacement?
I don't have anything for you right now. Tamar's doing a great job, and we can get back to you on what the process is. I haven't asked about it lately.
Okay, and I think there had also been a mention around the time of Brian's departure being announced, a mention of looking at restructuring the managing director's office. Is that still underway?
That's ongoing.
Is there any timeline for that?
Not at the moment, no.
Okay, thank you.
Thanks, Laura. We're going to go now to David Melandra Jr. with the Philadelphia Sports Network.
Thank you. My question, first off, is for Dr. Farley and for Mayor Kenney. Last week, the Philadelphia Eagles came out and said that they would not have fans to start the season. What are some of the factors that you'll be looking forward to if you were to give the green light to let them have fans later in the season?
I would just say, our concern is the very large number of people that might need to go to a stadium that people consider a typical football game, and the difficulty in getting those people to wear masks. And so I'd have to be persuaded that case counts are low enough that there would not be substantial risk if there were many, many people close together not wearing masks.
And my second question is, last week the city sent out a policy about tailgating. I've had several people asking me, saying, how is the city going to enforce the no tailgating thing for the Eagle games, especially with FDR Park being open to the public?
Well, I expect that the lots around the stadium will not be open. I'm not sure of that, but I would expect there's no reason for them to be open. So there's very little place to tailgate. And we have general police patrols that go through the park on a regular basis. And we have also people down there who use the park for non-tailgating, non-football related uses. And they're playing tennis and they're riding their bikes and doing lots of stuff. So I'm sure we'll have there's eyes and ears of folks there who can call 911. And there'll be police patrols and there's around that area as their normal is. And they're going to be told that they can't do that there.
And my last one, Dr. Farley, talked about your new sports policy for athletic competitions. Temple football came out last week saying that they don't think they'll be ready to start their season because they've not been able to do full-on scrimmages. What do you suggest to them about how they think they'll be ready to prepare for their season?
I'm sorry, you said Temple football?
Correct.
Yeah, so we're talking to Temple individually about how they can handle football.
All right, thank you.
Thanks, David. We're going to go to Manny Smith now at CBS 3.
Hey, just 3 quick questions. I wanted to follow up with the mayor just on Laura's question real quick. So originally, I know in the release when you guys talked about Brian departing, that he was going to depart on September 4th. Is that not the case? Is Tamar now the official acting managing director?
Brian is departing on September 4th, and Tamar will assume that role for the foreseeable future till we figure out what we do going forward.
Okay. My second question is for you and Dr. Farley. We've been covering extensively a lot of the local Catholic schools who have been looking for different ways to still try to get some sports approved. We know there's been a pretty big base over at St. Joe's Prep, which is the number 3 team in the nation, I believe. What do you say to those guys who may not be able to play? He was kind of looking for not only the opportunity to play, but might have scholarship eligibility on the line by not being able to participate.
The scholarship eligibility, I believe, on a team of that caliber and of that well known, that the folks that are being recruited have been recruited for quite some time now, and it's not just this particular year that's going to determine whether or not they get an offer. I hope that's the case, but from a medical standpoint, doctor, that's to you.
Yeah, having people slamming into each other is not safe at this point of the epidemic. And so I'm sympathetic. I don't want anybody to lose a scholarship. This is not unique to Philadelphia. This is happening all over the country. And so I'm hoping everybody understands that and interpreting steps like scholarships in the future. But we don't want to stoke an epidemic with football games.
All right, thank you very much. And then my last question is tonight, you guys might be aware of the Light Up for Red live events coalition. It's, going to be in support of theater and entertainment workers who are out of work for the foreseeable future. Any messages to those folks who are struggling?
Hang in there, continue to help work with us to stave off this pandemic, and we'll open up as soon as we safely can. I recognize the frustration. Everybody's frustrated. I have no magic answer for any of these industries that are impacted more so by the virus because of ultimately what they do. They project from a stage. They have an audience that sits close to each other. I have no answers for that. We will continue to drive these numbers down, do our best to get ourselves to some normalcy, and begin to and continue to open up safely as we're doing on September 8th with the restaurants. By the way, Tumar Alexander will be acting starting Friday.
Starting Friday. Thank you very much.
And he's doing a good job, by the way.
Thanks, Manny. We're going to go now to Martin Pratt of Philly YBN.
Yes, this question is for the mayor. Well, it's really a statement and a question. My garbage was picked up today on time, early. So thank you.
Thank you.
Is there any statistics or any stats right now as to how long you will keep the temporary workers along? Because it does seem to be working.
Yeah, I mean, I don't think anything's going to change. I think they're on for 6 months, 6-month clips. We're hoping that some of our full-time workers will be able to come back, quicker and healthier. I'd throw it over to Tumar for any more details.
Yes, that's correct, Mayor. We're allowed to keep the temp workers for 6 months.
Okay, thank you. And this next question for Dr. Farley. Dr. Farley, as we've been hearing, sports is such a big deal, especially in college and high school. Would you recommend forming esports leagues as a way to get around this social distancing?
If you're talking about esports, you mean people sitting at their computers. I'd rather have people go out for a walk or get some physical activity. We all spend a little bit too much of our time online. So it's not the physical activity that causes COVID transmission. It's getting close to other people. And so there are ways to be physically active without doing it.
So that's a no.
Correct.
Thank you.
No. You'll probably save money not betting too. So.
Okay, thank you, Martin. We're going to go back to Natasha Brown with CBS 3.
Hi, this is for Mayor Kenney. Mayor Kenney, I know you talked earlier just about the meal sites around the city, and you're excited that, folks can have the meal sites there, 62 sites, I think you said. Yes. Some parents have talked about the fact that, now that they'll be also juggling virtual learning with their kids, they're trying to get to these sites. They're, only a certain amount of hours you can get there. Are any ideas to maybe, will they be expanding throughout the year, other days available and times expanding, or? Someone
correct me if I'm wrong, but I believe that you can send a neighbor. I'm not sure that changed or not. You can send a neighbor or someone else to pick up the food. Is that true still, Eva?
You'll no longer need ID, right. But in addition, during that pickup time, I believe they're giving out a week's worth of meals at this point.
I see. Okay. And then one other question. I'm not sure if Mayor Kenney, if you could respond to this, but some parents have also been a little concerned about the fact that Chromebooks they say that they're not able to get their hands on them. They're running out in certain areas or certain distribution spots.
Well, they can call our office here at 686-2181, I believe, and also call the school district. We can refer them to the appropriate people in the district because they were handling, I believe, the distribution of the books.
Okay. All right. Okay. That's all I have. Thank you so much.
Thanks, Natasha. We're going to go back to Claudia Lauer with the AP.
Hey, my questions this time around have to do with the suicide prevention numbers, Mayor. You had said there had been an increase of 17% over last year at this time. Do you have the actual numbers or a source for that?
Yeah,
I do not. Okay.
I can respond to that. Hi.
Okay,
it's from the City Medical Examiner's office, and it's to 91 cases this year.
You cut out. I'm sorry, you cut out there. Could you say that again?
91 cases this year so far, and same time last year, 78 cases. So it's up about 7%. But the calls to the Philadelphia Crisis Line and suicide-related ED visits are down, and that's concerning because you want outreach. So the mayor mentioned some things that you can do if you're concerned about a loved one, and we strongly encourage that. Asking if they're thinking about suicide, listening without judgment, keeping them safe, connecting them to professional help, and continuing to follow up. And I just want to say the crisis line for help is 215-685-6440. And there's a lot of resource information on Mindful Together, mindphltogether.com, and healthymindsphilly.org.
Okay, thank you.
Thank you, Claudia. We're going to go now to Kennedy Rose of the Philadelphia Business Journal.
Hi, I just have one super quick question for the mayor. I was wondering about the possibility of having polling centers at the Link at the Wells Fargo Center. I know officials have already initially declined to use those spaces, but what would the circumstances have to be for the city to use those sites?
Well, my understanding is that they found sites within the area that are closer than the stadium complex. But I could check with the people who are running this, the city commissioners, can find out what it is their criteria is for using that. I mean, it's wonderful that the teams offered to use it, and I appreciate their civic mindedness. And if we need them, we'll use them. But in the meantime, we'll have to get back to you relative to what the criteria are to use the sports complex.
All righty, thanks so much.
Okay.
Thank you, Kennedy. Seeing no further questions for today, that will conclude our briefing, and we will be back at 1 p.m. on Thursday. Thank you.